everyone, welcome back to my channel, Your Free Consult, and today's episode is going to be a really important one. Being a cosmetic gynecologist, I deal with a lot of women who are survivors of this horrible practice, FGM. This is going to be a really important one, so stay tuned. So let's get quickly into it. What exactly is female genital mutilation, FGM? FGM is a horrible and unnecessary and harmful practice that is intended to injure or alter a woman or a girl's female external genitalia or even internal genitalia, and this is done for non-medical reasons. So what are some of the reasons why people perform FGM? Some of the reasons are social, some of them are cultural, and in some instances they're even religious. For the social reasons, many communities believe that girls who've undergone FGM will be less promiscuous. For the cultural reasons, it's because of hygiene, it's because of honor, it's because of marriage, and some communities even believe that it increases fertility. The bottom line is that female genital mutilation is a complete violation of a girl and a woman's rights. And these rights include the right to freedom from torture, the right to life, because sometimes FGM does end up in death. It's an infringement of children's rights because this is done to minors many times. FGM is actually also an infringement to the right for equality, because remember, this practice is only for women or girls. It's not performed on males, so it is an infringement to the right to equality. Now let's look a little bit at the circumstances around which FGM happens. Who is the provider of FGM? It's definitely not a medical practitioner. So the person performing the FGM is really a traditional herbalist or a healer, somebody who's not a medical professional. Let's also look at the circumstances in terms of consent. Many times the FGM procedure is carried out on someone who's a minor, who's not able to give consent. And even when it's not a minor, many times the person does not give consent for the procedure. Let's look a little bit at even the tools that are used. They're not medically approved tools. Sometimes they're razors, knives, pieces of glass, bottles, things that are not supposed to be used, things that could cause a lot of effects such as bleeding, infections, and permanent damage to nerves. Let's also look at the purpose of this procedure. It's not medical. It doesn't add any benefit or value to the girl or woman. Most of the time the practice is completely non-medical. Now, a lot of efforts have been made to end FGM worldwide, but there's still over 30 African countries practicing FGM actively in Africa, and even other countries around the world that do still practice FGM. As a cosmetic gynecologist, I do a lot of reconstruction for female genital mutilation, and it makes me come across these women, and I can tell you for sure that they do tend to suffer quite a bit. So now, the FGM concept is very foreign to many women, and I'd like us to look at what are some of the types of FGM. What exactly happens when a woman has undergone FGM? What exactly does it look like? Now, when we look at the types of FGM, the World Health Organization classifies them from type 1 to 4. But type 1 is where there is partial or complete removal of the clitoris, where the first type, type 1A, is where only the hood of the clitoris is tampered with or removed, and type 1B is where the entire clitoris and its hood is actually completely removed. Type 2 FGM involves the removal either partially or completely of the clitoris, the labia minora, and the labia majora in different combinations. In type A, only the labia minora are removed. In type B, the labia minora and the clitoris are removed. And in type C, you have partial or complete removal of the clitoris with removal of the labia minora and the labia majora. Type 3 of FGM is called infibulation. It means sealing of the vagina, either completely or partially. And this can be through the repositioning or removal of the labia minora or the labia majora, where type 3A is repositioning or removal of the minora, and type 3B is repositioning or removal of the labia majora. And type 4 of FGM is anything else that doesn't cover the first three types. For example, piercing, scratching, making a hole hole, making a mark, tattooing, or any other thing that does not distinctly describe the first 3 types of FGM. Now, patients who undergo FGMs or victims of FGM do undergo very horrible, what we call sequelae, the aftermath of FGM, and this can either be immediate effects or long-term effects. In the immediate situation, they can go through severe bleeding, even to death many times. They can go through infection, they can go through urinary symptoms, and they can go through genital swelling. And what the OBGYN or any other person encountering these people is supposed to do is to provide pain relief through pain medication, prevention of infection through antibiotics. Occasionally, they may require a surgery to stop the bleeding. Now, in terms of long-term effects, FGM survivors or FGM victims undergo an array of horrible effects. One of them is clitoral pain or chronic vulvar pain. They go through a lot of pain in the vulva. Some of them get recurrent urinary tract infections and urinary symptoms like frequent urination, urgency, pain during urination. Some of them, when the vagina is sealed, are unable to have a normal menstrual period, so they get menstrual abnormalities. Some of them are not able to pass urine freely. Some of them end up having very painful sexual intercourse or being able to undergo a condition called anorgasmia, where they are not able to achieve an orgasm during sexual intercourse. Some women have very difficult labor and delivery because of the sealing of the vagina, and the baby is just generally not able to pass through. So when they encounter a medical professional, that professional should proceed with a process called de-infibulation, where they release the sealing that was done in the vagina, and this could be very painful for the woman. Women who undergo FGM are not able to access certain types of family planning. For example, with sealing of the vagina, they cannot have an intrauterine contraceptive device. They may also suffer in terms of having access to cervical cancer screening, because when the vagina is sealed, they're not able to have a pap smear, and this could endanger their life by causing cervical cancer when screening cannot be done. The practice of FGM could predispose them to HIV, because remember, we talked about the tools of FGM, which are razors, bottles, pieces of glass that are shared amongst many children and many women and could cause the transmission of HIV. Many women really suffer through labor because their baby is simply not able to pass out through the vagina, and it could cause obstructed labor, which could end up in death of either the mother or the baby. Women who have FGM could also end up with reproductive tract infections such as vaginal infections, cervical infections. They could end up with skin conditions such as keloids where the FGM was performed, and they could end up with other genital swelling such as genital cysts. So what are some of the solutions for women who have undergone FGM? Some of the immediate solutions that they require are what I've mentioned before: pain management, antibiotics, stopping of the bleeding. They also require extensive counseling because they undergo a lot of psychological torture during these FGM moments. They may also require what we call platelet-rich plasma therapy to be able to restore their sexual function in the remnants of the clitoris that are actually left. They may require radiofrequency therapy to be able to build up collagen in their vulva, in their vagina, to increase sensitivity and to allow them to be able to have comfortable sexual intercourse. They may require access to support groups where other women who've undergone FGM could actually share experiences with them and be able to let them know that they could actually survive and that there is help in their current situation. They may require to undergo reconstruction surgeries to be able to reconstruct the damages of FGM. They may require de-infibulation, which is the unsealing of the vagina, and they may also require treatment for chronic nerve damage that is caused by the practices of FGM. You can never really treat a woman wholly who has undergone FGM because you can never take away what happened to her, but it's important that women know that there are resources for helping each of the problems that they face after FGM, but more importantly that we make quick strides to be able to end FGM. I really hope you enjoyed this episode, that you learned a lot, that you'll be able to pass this information on to someone else and save a life and help end FGM. Thank you so much for tuning in, and see you next Thursday on your free consult.